I would say that I do have a heart for people. Every day I'm involved, I'm providing some type of care to someone in our community. One of the things I think that makes me so passionate is having the experiences that I've had within healthcare. And one of the things I really found that I liked was being able to simplify a message to a level that a patient may understand. Right now, one of our main projects has been the screenings with cancer screenings. I think one of the biggest things is really understanding the reason that we want them to do the screenings. So a lot of the times people are afraid to provide just the general education. This is a disease, this is what happens at the end of the disease, this is what you can do. We really want to make sure that people are there and living tomorrow, and how do you do that? You do that with screenings. I got connected through American Cancer Society, and right away from the beginning, it became a love relationship with them. I love what they stood for. I knew who they were. I had used their services in the past when my father had prostate cancer. So I knew a little bit about their resources, but when I started to work with them, it was great in the sense that I was able to see behind the scenes. And from that, I just got really involved. When I moved to the Venice Family Clinic, we really hadn't worked with American Cancer Society at this organization. We started with a very small grant of $500 for mailers, and those $500 grew to us receiving the American Cancer Society's Change Grant funded by the NFL, which was able to assist us in improving the cancer screening that we were providing for our patients. We really wanted to provide high quality care, and what we were able to do with the funding was that we were able to standardize the way that we were providing care and really decrease barriers for our patients. We focus on 3 cancers: cervical cancer, breast cancer, and colorectal cancer, and really trying to see how can we bring these rates up. We had health fairs. We went out and did things with the community. With our colorectal cancer, what we were able to do was that we were able to mail kits out to our patients, so that reduced the barrier. For a lot of our patients that are experiencing homelessness, one of the big problems that they have is where do they get care? One of the things that we were able to do was we were able to bring mobile mammography to our patients that are experiencing homelessness. Now, the mobile mammography van is part of our workflow. The Change Grant was the catalyst that created this. For our cervical cancer screening, we were able to really see what is it that the patient needs. And one of the things that many of our patients said was that when it's time to get their appointment, they felt unclean. So one of the things that we did was that we created some hygiene kits that the patients are able to receive. We also created a VIP pass where a woman can have a shower before her cervical cancer screening gets done so that she can feel comfortable, and be able to be at ease while she's getting this done. Being able to work in an organization that really makes it important to complete cancer screenings and makes it important to really bring health equity to all of our patients, that's what motivates me. That's what gets me going. That's what gets me coming back to work every day.